All right, for those of you who are at home and watching this now, if you can't hear me, you can certainly read there. We'd like you to turn your volume up. On the lower left, you're going to be able to see something that says Q&A. You can click that and you can type in questions that you'd like to have answered throughout this webinar. Okay, so here we're talking about how exactly stem cells solve pain. We all want to start with our common goals, and we all have very similar goals, certainly both on both sides of the examination table, from both the patient's perspective and from us, the physicians. We want to, number one, avoid surgery. Number two, we want to stop relying on medications. Certainly the opiate epidemic has given us cause and focus on not relying on meds. Number three, we also want quality of life. But in order to achieve this, we want a plan that's going to give us that best quality of life. We want to be safe from high risk, as well as excessive recovery or any hidden pitfalls. So stem cells are not just good or better, or they're actually really the best way. And what we see in using stem cells and why they're so great is they have a high success rate. They're something that you can get years of relief from, so not just something to be repeated every week, every few months. And we're talking about guaranteed acceptance, and we're talking about something that won't reject, your body won't reject it as a foreign substance, foreign material. It's important to know that regenerative medicine is not invasive surgery. It's not a medication. So it's really a different method. It's really an alternative to what's out there. Let's start off with some familiar examples that we've experienced in our office over the last several months. The first is our retired psychologist who flew airplanes for a hobby, but also ran for both competition and fun and stress relief. But back pain stopped him. It ended the competition, the source of fun, the source of the stress relief. Next, we have a chef who really enjoyed spending time with his family, but working in a kitchen and in a restaurant was a source of income. This was his career. The constant motion and the heavy restaurant equipment was giving him some concerns and thoughts about changing careers. But traditional medicine has failed this group, and the reasons are threefold. Number one, they were against surgery. They knew that with permanent fixations and hardware, that if things didn't go according to plan, that would sort of be a one-way avenue. And the second is that it's invasive, which definitely means long recovery, and for somebody like our chef, taking that much time off of work was just not a possibility. Number two, steroids were a Band-Aid, and over time they weaken and damage tissue. Not to mention repeat steroids means the repeat weakening and the repeat damage. Medications for them masked the problem, didn't solve the pain, it can lessen the symptoms, but unfortunately those effects wear off, and then you've got to go back and you've got to repeat the dose in order to get the same symptom relief. So for multiple reasons, it failed our patients. 2 months after stem cell therapy, this is where they were at. The psychologist was back to running. First year back, ran the 4th of July 4-mile race here in Saratoga. Is now training for a half marathon with his grandson, so quite a bit of success there. The chef back at work full time, able to depend on that career and income for his family, so that was important. So how exactly did we do that? And in order to understand how we did that, you have to understand the cycle between pain and degeneration. So when you experience pain, it leads to degeneration. And once you start down the path of degeneration, you're unfortunately led to more pain. So our job here is to end this cycle. Here is a good microscopic example of what stem cells do once we insert them into particular regions. The pain, the stiffness, the sciatica symptoms you feel, the nerve pain, the neuropathy, you can imagine that as being the red. The green is an example of cells, our stem cells, attacking the red, which is clearly bad. My more simple example is Pac-Man. And of course, the objective in Pac-Man is to clear the body. If you can imagine the pellets as being inflammation, let's just say, for example, one Pac-Man is equal to platelet-rich plasma, but having thousands of Pac-Man plus those power-ups is what stem cells are capable of. The goal here is not to just beat the level, but to leave the game entirely. And when the therapies are applied, we're talking about 5 to 10 years of leaving the game and not having to come back to this. So where exactly do stem cells come from? The stem cells in our office come from you. The picture of the rotating pelvis on the left is where we extract our bone marrow stem cells from, and we insert them into various parts of the spine. So again, not a surgery and not a medication. And there's some examples of, for example, a degenerative disc that may be injected. Our basic timeline and schedule looks something like this. At the beginning, we'd like a consultation, and that helps us review with you what your symptoms are, any imaging that you've done to date. Pretty quickly after that, we'd like an MRI. And once treatment starts, we have our first PRP, then going on to a stem cell and a second PRP, and then shortly thereafter, a third PRP. Once that's done, we need you to regain strength. We need you to keep that back healthy and strong, or whatever. We may be injecting knees and hips and whatnot. So that's where physical therapy and chiropractic partners come in. What exactly is regenerative medicine? It's a completely new field of medicine that is really starting to grow, starting to expand. And the goal here isn't to not replace the tissue, but restore. So restore and not replace. So replacements are surgical, and ours is really biological. We take the damaged tissue into healthy, functional tissue. And we use this with different materials to restore that health. Platelet-rich plasma and stem cells, well, what's the difference? If you can imagine platelet-rich plasma, again, going back to our Pac-Man example, it's a smaller tool and therefore designed for more smaller problems. Stem cells is a stronger, more bigger tool, if you will, and is applied to much bigger problems, or more severe problems, we should say. So when we talk about the neck and the back, what are the ideal diagnoses that we apply this to? So here's just a few examples. This isn't comprehensive, but stenosis, arthritis, degenerative disc, and issues leading to sciatica. For the lower body, again, more arthritis, meniscus issues, tendon damages. What about upper body? Here we're talking about rotator cuff tears. We're talking about carpal tunnel, and yet even more arthritis. And you can see a pattern forming here. One of the most common questions that we get is, am I a candidate? So if you can imagine, any part that can be operated on or injected can also receive stem cells. So again, any part that can be operated or injected can also receive stem cells. And here is the key point. And one of them, the the most important key points to getting stem cells started or coming down the path and looking into stem cells is whether or not you have a diagnosis. Because if you have an accurate diagnosis, then your success rates are far better, far increased. To keep in mind, we are the only regenerative medicine provider with an in-house MRI. And obviously for us, that's something that helps us with that diagnosis component, helps us with guidance of where these stem cells are going to be applied to. And for us, it's part of our therapy plan. So what if I've had surgery? Yes, you can still be a candidate. Again, the key to this is, do you have a correct diagnosis and any current imaging? Most likely those who've had surgery have had recent imaging. Here, the history and exam that we gain from you during our consultation is incredibly important. The kind of surgery you've had is also crucial. Arthroscopy versus total joint replacement. Obviously, if you've had a total joint, it takes away much of the body parts, if you will, that we need to inject. So there are some limitations. Let's get to the questions that people have asked, and a lot of information is to be gained here. So frequently asked question number one, where will my stem cells come from? And again, going back to the pelvis picture, they come from the center of the bone. And we choose the back of the pelvis as that's easily accessible. Quality of stem cells are high there. Second question, how long before I can become active? So it's going to take a few weeks. Recovery after that PRP number 2 plus the stem cell injection is where we put the most amount of activity limitations. And so everybody's a little bit unique, but the recovery from there typically takes about 4 to 5 days. Next question, when do I feel the benefits? So Doc, when can I get back to walking, running? When can I get back to living my quality of life? So that's a great question. So a majority of our patients feel benefits within the first 4 weeks. And then I would say a minority feeling benefits from 8 to 12 weeks. That is not the maximum benefit at 4 weeks or at 8 to 12 weeks, but that's the beginnings, meaning that maximum benefits can take sometimes 6 months, sometimes longer. Next question of how long will the tissue stay repaired? I hinted at it before. We're talking about therapies that last 5 to 10 years. So gone are the days that you do steroid injections and have to do repeat steroid injections every 3 months, every few weeks. And the next question is, how well does this work? And that's obviously a critical portion to exploring stem cells. So for us, pretty consistently, we would say 85% of our patients getting 85% results. So that means reduction in pain, improvement in the mobility, improvement in activity level. So that's a pretty robust sampling. Let's get to our questions and answers that people have been so kind to put in over the last month here. Sandra F asks, I've got severe back pain, spinal stenosis, sciatica, tried physical therapy, pain clinic, pain blocks, a lot of arthritis. What to do next? So here's a person who's got a clear diagnosis, who's got some failed therapies, went the conventional route. This is, in your case, Sandra, you're clearly ready for stem cells. You're clearly ready for that next step. Obviously, a consultation would be the next thing for you to flush out any additional questions, but that's where we would point. That's the direction we would point you. Susan B asks, I have undetermined back pain. MRI shows L4, L5, disc bulging, being steered towards an SI joint injury. What are my thoughts? This is a case where the importance of diagnosis is necessary. So for me, the diagnosis is unclear. The consultation is key, and during that point in time, after reviewing MRI, reviewing your physical exam, we'll have a much better understanding of your diagnosis and then therefore how our therapies exactly apply to you. And then, of course, along with that, the success of those therapies. Marguerite L asked if regenerative medicine is appropriate for back pain that's been ongoing for years. So for us, I can't stress this enough, the length of the time that you've had the pain is irrelevant. In Marguerite's case, the diagnosis is a little bit unclear, but clearly she's had years of it. So imaging and exam is going to reveal this pretty quickly. But we've had patients with decades of degenerative disc pain and still have successful results. Our psychologist we talked about earlier had pain for years, to the point to where he couldn't fly his plane more than 45 minutes before he'd have to touch down because pain was limiting. Chris R asks about ASD post-op ACDF. So for those out there, ASD stands for adjacent segmental disease, and ACDF stands for anterior cervical disc fusion. So basically, once you fuse a level in your spine or in your low back, the disc both above and below start to degenerate, and actually can degenerate a little more rapidly. This is what we call failed spine syndrome. So patients with this in our office and in our experience respond incredibly well. The fusion will create certain limitations, but for the adjacent segmental disease, excellent results. So for somebody like you, Chris, coming in for a consultation, getting a recent MRI are all important steps, but all met with excellent outcomes. Raisa asks, what about a shoulder with a torn labrum, injured tendon? How long do I have to rest? What kind of restrictions? And what is the rate of success? So in this case, for Raisa, the diagnosis is clear. And an important next step is both the consult and exam. We would probably say this can happen within a single treatment course, meaning that you're not going to need, something every 3 months, every 6 months, every year. But it is a little bit complex in that there's a torn labrum in addition to a torn tendon. So therefore, we're going to have to develop a specific tailored protocol for you. But the instructions will therefore be a bit blended. A torn shoulder and a torn tendon, or injured tendon, I should say, have different restrictions. So we'll have to combine a lot of that. We've had a patient similar to this case here, who was over the age of 90 and had excellent outcomes, was actually in a recent commercial shoot for us. So that should be out soon, and just doing great. Next question, Debbie S. and Riaz R. asked about tendon and tissue pain in foot, as well as knee pain after partial meniscectomy. So we're talking about some issues outside of the spine. So tendon issues, meniscus issues are very common in our office and respond excellent to stem cells. Here's another case where both diagnosis is well understood, probably imaging has already been had. So consultation is going to be key, but response to stem cells is high. Something we've treated many, many times in our office. Jean asked, bad back pain for 2 months. I'm taking 8 Lenotec and doesn't help much. So here's a case where we've become either dependent on medications, but then unfortunately the medications fail us. So it sounds like if you've had pain for a couple of months and you're not responding to medication, you're pretty close to developing a diagnosis. And really that first discussion that we have between the discussion, the exam, maybe any imaging you might have, the diagnosis is going to become very clear. And then we can talk about your options for therapy once that diagnosis is made. Linda P asks, I have spinal stenosis, possible neuropathy, interested in treatment protocols for both. Unfortunately, they're out of town, so might have poor reception. So Linda P, if you're listening to this, thanks for making it on despite the poor reception. In her case, the diagnosis is clear. The spinal stenosis is well established. But for us, success for nerve damage is based on two factors, and the two factors for us are as follows. Number one, whether how long you've had the nerve damage. So the longer you go on having that nerve damage, the more likely that's going to be a permanent issue for you. In which case, neither surgery nor medications nor anything will make that recoverable. The second is whether there is a wax wane component, meaning that the pain at times is worse and at times is better. So again, two factors for successful treatment of nerve damage. Number one, the length of time you've had the nerve damage, and number two, whether or not there's a wax and wane component. So come and go. Sally, Michelle, Anita, and Denise had some similar questions, so I grouped them together. First question is, will it help facet joint hypertrophy, degenerative disc disease, regenerative medicine helping back pain, and the cost? Next question, what is the procedure like? Suggestions on benefits, success, what issues benefit, success rate and cost. And next is MRI necessary because somebody's got a permanent blood clot filter. So unfortunately, with costs, it's really hard to estimate over the phone or over email. It's similar to mechanics and cars. It's like asking a mechanic, how much is this car issue going to cost? Impossible to say until once they lift the hood and take a look. So for us, that consultation is key in terms of understanding what your issue is, and then obviously we can help establish what certain things will be in terms of cost. MRI for us is gold standard, but it is not the only standard. So that's a really good question. For us, we've been able to treat people with CT scans and x-rays, but obviously having the most amount of information, being able to make the most successful diagnosis is a key to this process. So Anne, Jennifer, Martha, Mary, and Beth have some similar questions here as well. Osteoarthritis for pinched nerves, lower back pain going to the glutes, L4, L5 disc issues causing back, butt, and leg pain, understanding how stem cell therapy helps sciatica and lower back pain. So for a lot of these people, they describe what is essentially sciatica. So your diagnosis is almost all there. It's almost completely clear to me, but there is going to be just a little bit of confirmation that needs to happen during the consultation. But for many of these sciatica type symptoms, pinched nerve issues, stem cell is going to likely be the answer. And we've been able to help a lot of people and a lot of folks with many of the similar symptoms here. Herbert, John, Robert, Barbara, Jeannie, and Stefan also asking some similar questions. Interested in stem cell for bone and joint issues, bilateral hips have been replaced, might need knee replacement. Can it help with that? Cure sciatic nerve problems, which we talked about just a moment ago. Does stem cell help advanced osteoarthritis? So this is a great question. If so, who's a good candidate? And can stem cell help repair occlusions in the eye? So we're talking about a completely non-musculoskeletal issue there. General overview and whether nerve damage from trauma, and then how it works, and then and the last question is, can it help ciprofloxacin poisoning? So let's just go through these one at a time. So yes, to the knee, many knees have been treated in our office and in the literature, so a very common site for pain with high degree of success. Sciatic nerve issues, again, similar to before, very close to a diagnosis, consultation, MRI, a few more steps, but very successful response with some stem cell therapy. Next, advanced osteoarthritis. So this is a good one, and this goes into the candidacy question. So we've had people who've been quote unquote end stage osteoarthritis, whether that be for knees or hips or low back, and still have incredibly great outcomes. Again, treating 93-year-olds, you can imagine their arthritis or their degeneration is pretty advanced, and they've been able to respond well. Whether or not stem cells repair occlusions in the eyes. So at this present moment, musculoskeletal complaints are the only issues that we treat. There are ongoing and developing studies for stem cell therapy for non-musculoskeletal, non-MSK issues, and they're continuing to develop. So somewhere down the pipeline, you can expect that. And nerve damage from trauma, again, two factors really speak to the success of that: the length of time you've had the trauma, and number two, whether there's a wax and wane component. And the last question about ciprofloxacin. So for those who don't know, ciprofloxacin is a fluoroquinolone. It's a category or class of antibiotics, very useful in terms of its antibiotic purposes, but unfortunately one of the side effects is that it can cause some really serious tendon damage. And we have had unfortunately several people who've had this, but we're successful in both treating them with both platelet-rich plasma and stem cells as well. Again, it depends on the severity. Is it a small problem? Is it a large problem? That needs to be understood. Sally, Mark, and Henry asking about insurance here. Do we take no fault? Does insurance cover it? And then lastly, where's our locations? So we, at this moment, have 3 locations, Plattsburgh, Skinny Atlas, and Saratoga. Yes to the no fault and no to the insurance. So no fault will cover MRI, it'll cover initial consultation, but both no fault and commercial insurances do not cover regenerative medicine therapies. And it's unfortunate, but that's the current landscape of our healthcare. Carlene and Nicole ask, how long are they effective for, and effectiveness of stem cell for arthritis. So for arthritis specifically, excellent outcomes. Again, length of time that this kind of therapy is beneficial for, we're talking about 5 to 10 years. And specifically to the spine, you know, we think more than 10 years is certainly possible. Teresa, Jay, Shanley, a lot of names here, but I'll go through these questions one at a time. We have back injuries and neck issues from a retired paramedic. Obviously, thank you for your service and hard work that you've put in, but a lot of heavy lifting over time is going to create these sorts of injuries. And this is what we call micro trauma leading to macro trauma. So small instances of pain accumulating over time respond very well to our stem cell based therapies. My guess from just reading that one line is that you've developed degenerative disc issues in both the back and neck from years of lifting heavy stretchers. And if that's the case, then yes, excellent response to stem cell therapy. Next question, arthritis pain, lower back pain, spinal stenosis, degenerative disc. Yes, great application for stem cells. Very, very common in our office. We treat these constantly. Next question, how to get and keep your back healthy and pain-free. So obviously, if you're in pain, need to get to the point of being pain-free. Once you're in pain, a lot of the outside in Therapies can be a little bit limited, acupuncture, physical therapy, chiropractic care. Our therapy is really looking at it from the perspective of going from the inside out. And once we get you to that moment of being pain-free, then it's going to be about keeping it healthy. And of course, good nutrition, hydration, all this is important. Physical therapy, regular chiropractic care, preventative methods, learning to lift correctly. All of this can be very effective in the long run. Next question is, can discs be repaired? Yes. So the question of whether there is a physical repair happening, the microscopic example of the stem cells attacking the bad red areas was seen. But this is not a repair done surgically. This is a repair done biologically. And so it doesn't look like a surgical repair. It doesn't feel like a surgical repair, but you know that it's better. How? Because you have less pain. And that is, as we say, the proof in the pudding. Next question. I included because it talked about somebody asking specifically about chronic back pain. Again, pain that's been there for years, for decades. Excellent results from regenerative medicine applied to these areas. But even though you've had chronic back pain, where's the pain coming from? Diagnosis is, again, an important issue. Next question, whether this is an alternative to lumbar fusion, which is the direction that you're heading in. And I'm sorry to hear that. But I have to tell you that this is and should be the step before lumbar fusion is even entertained, even talked about, even discussed. Being able to apply these therapies to that degenerated disc, that degenerated facet joint, the ligaments, the muscles, the tendons, can really stave off lumbar fusion. And we're talking about not just a day or a week or a few months. We're talking about potentially a decade of not having to think about back pain, not having to think about fusion. So yeah, it's an excellent alternative. So this is an offer for those who've attended. I wanted to thank you for your time and listening to me go through all of this. For those who have attended the webinar, offering you a free consultation. The deal is that you've got to call by Friday. Please mention the word webinars. You don't have to have the consult by Friday, but the call has to happen by Friday. There's our number there, 518-871-9900. We plan to do another webinar in October, and so look out for that. We'll release the date probably in the next 24 hours here. You can also find the future webinars at richardkimmedicine.com/webinars. For those who are interested in developing a diagnosis, on working on getting a diagnosis, richardkimmedicine.com/MRI for a self-serve MRI. That's right. You can just call, schedule your own MRI, and have that in hand when we're ready to talk about stem cells. Okay, so I'm gonna cancel, escape out of that. And stop sharing. Okay, so we've got a few more minutes here, and I see some Q&A questions already. And I'm going to start off with the first question. Sorry, I'm going to get a little closer here. Bob's got a question. Does this have any usefulness for nerve damage from an accident? Shattered ribs, plated, titanium plates and screws. Nerves were destroyed, according to the surgeon, and 2 years later have not healed. So again, nerve damage really falls under two categories. The length of time that you've had the nerve damage, number one, and number two, the wax and wane component. Does the pain come? Does the pain go? That's an important aspect about it. So during our conversation, during consultation, we can talk about it and see and ferret out some of those answers. And once we understand some of that, we can talk about, how effective the stem cells are for you. Tony asking about scoliosis in an older person. Absolutely. So scoliosis, for those who don't know, is a curvature of the spine. So initially, when you're young and you're in your teenage years, oftentimes doesn't cause a lot of pain, but certainly as we get older, the curvature can start impeding on disc health, lend itself to degeneration. So it's an important cause of degenerative disc and back pain, but we treat those with scoliosis and back pain quite frequently. Justin asks, will it help with the broken vertebrae and deformed lower vertebrae and a person that has multiple issues over their body? So yes, so those who with broken vertebrae typically heal on their own, but what we find is that those who've had broken vertebrae disrupt the disc both above and below. So you can go on to develop chronic pain even though the vertebrae has healed. The multiple issues, we'd have to understand what those issues were. So it's hard to talk, sort of speak to that. But specifically about your question about the broken vertebrae, yep, something that we see often and can treat pretty regularly. Tony asks again, Tony asks, if it works for 10 years, can you get it again? Excellent question, Tony. Absolutely. So because the stem cells come from you and are put back into you, they are all your cells. And therefore, as long as you're alive and healthy, the more stem cells can be extracted and put back into you. Somebody may be thinking, well, if you take stem cells out, will it replenish? Yes, absolutely. You can imagine it as this factory that lives within the bone to constantly churn out new and upcoming stem cells. So that's a very renewable source of energy. We all love renewable energy. So it is absolutely something you can repeat in 10 years. Okay, so that's the 4 major questions I've had coming up. Just exit out of that. So for those who've had future questions, you can always email us, you can always call us, and you can always reach out to us in several different ways, calling us at 518-871-9900, or you can go to the webpage and schedule your own consultation. So that's it. For those with any future questions, I'll hang out for a minute here, but otherwise, thanks for attending. Okay, so I'm going to say that that's it. Everybody, thanks again. Talk to you soon.